First, let's welcome Dr. Kerry Partis of Novant Health Family Medicine, Pine Forest. Dr. Partis, it is so good to have you on the show today. I'm really excited, and we've got several new physicians in the area, and so we usually start off, kick off these sessions with learning about the new physicians. So tell me a little bit about your education and your experiences.
I went to medical school in St. Martin. And,
that was such a chore, wasn't it?
Oh, yes, for sure. And then did my residency in Arkansas, so I decided to come on back to North Carolina to practice.
Well, that's great, and we're so happy to have you here. But I'm curious, what brought you to this area? What interests you here?
I'm from eastern North Carolina, and I like the beach, so it's kind of a best of both worlds.
Yeah, and I think that you came from a beach community.
I did,
right.
Yeah, I moved from the Outer Banks, actually, so nice to have a little change of scenery.
Yeah, it's a little different here than it is in Outer Banks.
Yeah, a little different, yeah.
But at least you have the water and the sand, so. So I understand that you've joined Novant Health Family Medicine in Pine Forest, which is one of our newer clinics. Tell me a little bit about your clinic.
It has a wide variety of services. There's a lab, an x-ray, ultrasound, and a fair amount of physicians with a bunch of offices. So it's nice to have a new facility.
It's a very nice facility.
It is.
And it's in a great location.
It is.
With the exception of the construction that's going on 211, but other than that, it's great. You have several partners in the clinic, as you mentioned, and a nice location. How many partners do you have there?
Currently, we have 3 providers in addition to myself.
Mm-hmm. And I think you have a nurse practitioner?
Yep, that's including a nurse practitioner and 2 MDs, a male and a female.
Mm-hmm. And I understand you have a new one coming pretty soon.
Should be coming this summer, a male physician moving from Charlotte. So
yeah, that would be great.
Yeah.
We'll have to have him on the show. So I know that you guys specialize in family medicine. Tell me a little bit more about that.
I see a wide variety of ages, you know, from birth to elderly patients, and
so you kind of take care of the whole family, is that right?
Yeah, kind of watch people grow up, and yeah, take care of the whole family. So
yeah, that's kind of nice, because it's when you walk in, you feel like you're part of that family. You know them all. You know the babies and the grandma and everything, and so there's a lot of things that go on socially that they may not offer, but one of the members of the family is going to tell you about it, right? One way or another, you're going to find out.
Get a little information from each one of them, that's right.
Yeah. Now, you say you see patients of all ages. Do you see newborns?
I typically start seeing patients about age 3 or 4 and up. I just haven't seen a lot of newborns of late, so I typically start about 3 or 4.
Mm-hmm. But I understand there are physicians in the clinic who will do newborn patients.
That's
so
right.
there is the ability to see them.
That's right.
Yeah, well, that's great. Well, Kerry, from a medical perspective, do you have any particular special interest in terms of what you like to see?
I like to do some procedures, and I have a lot of experience with geriatric patients. So,
nice. Well, that's kind of beneficial here.
Yeah, retirement community and the beach and whatnot. Yeah. So yeah, tends to drive a lot of retirees. So.
Yeah. What kind of procedures would you typically do in the office?
Some, you know, INDs, joint injections, so a wide variety of procedures, yeah.
Oh, well, that's nice. And it's really nice that x-rays there, too. So you
agree.
have immediate results.
Well, and patients don't have to travel.
Right,
you
they
know.
don't have to go anywhere else. It's like one-stop shop.
It is nice, it is nice.
Yeah, and the lab and all that, so that's a great practice. How about the hours at the clinic? Are they extended in any way?
I know they were with a prior provider was open till 6 o'clock. Currently, I don't think they're open past 5.
Mm-hmm. I think that probably will be coming.
I see.
As you add providers, they'll
Probably, yes.
be extending the hours.
It's been discussed for sure.
A lot of people like those early morning appointments. And then for folks who work, they need to come after work.
Well, certainly we're open at 7 o'clock with one provider starts at 7 a.m. So
nice.
Extended in the morning at this point. So.
Yeah, that's great. I know a lot of our offices are even starting to be open on Saturdays.
I've heard that. Yeah.
And that's really helpful, especially for folks who work.
That's right.
You know, Monday through
it's hard
Fridays.
to take time off work to go see the doctor. So.
Yeah. And at your practice, you have Epic, so you have MyChart, right?
Correct.
And I believe that patients can go online and schedule their own appointments.
They can. To my knowledge, I think it's for established patients that can schedule an appointment with their provider without having to call the office, so it's a lot more convenient.
And in addition, with MyChart, they can request refills for their prescriptions.
Ask questions.
Ask questions.
Yes.
That's the part I like the most.
Yeah, I do too.
Hey, why is this happening?
Sometimes it's easier to do in between patients rather than a call, so yeah.
True. And then if necessary, then you can schedule that patient to come in.
That's right.
You know, if they give you the kind of information that you think, oh, I better see this patient.
Yeah, I agree.
Well, we're really excited to have you here in the clinic. It's a lovely setup, and I know that one of your providers is returning from deployment.
Yes.
So that's going to be great to have her back in the practice, Dr. Pilar Johnson. So before we wrap up, is there anything else that you would like to add about the clinic or about your practice?
Not that I can think of.
So you are taking new patients, correct?
I am taking new patients, yes.
That's awesome.
I started about a month ago, so yeah.
That's great. So they just need to call the office, and we'll put that number on the bottom of the screen for the practice, and they just need to ask for an appointment with Dr. Kerry Partis.
Yes.
And you'll be happy to see them.
Yep, sure will.
Great. Well, thank you so much for being here, Kerry. It's been a pleasure to see you. And enjoy the beach while you're here.
I certainly will.
Thank you.
Thank you.